me. Congratulations, professors, for winning this year's Vattikuti supported best paper in robotic surgery in European urology. Could I ask you to briefly tell who are the authors, what was the objective of the study, and why this paper was distinct than other papers?
So, I would like to first of all thank European Urology and Vattikuti Foundation for selecting this paper as the best robotic surgery paper published in European Urology. This paper actually is an atlas of different technique about neobladder after robotic radical cystectomy, and this was an idea that we had inside the EAU together with Dr. Paolo Dell'Olio and Dr. Filippo Turri and Dr. Blarker. We think about this opportunity to make a systematic review, and so to actually find out which are the different techniques described in literature in a proper and scientific way, and then to create a surgical atlas where we actually contact all the surgeons as my mentor here, Professor Porpiglia, that show which are the techniques, the tips and tricks for carry out this complex procedure also for expert robotic surgeons. And we believe in the value of didactical atlas, because these techniques, when are properly showed, when are properly taught, can be reproduced also outside the super expert surgeons. And so finally, I would like to thank Professor Porpiglia for being my mentor, for pushing me in the way of scientific research, and for teaching me all the tips of surgeries that guide us through this experience.
Next question to Professor Porpiglia. You are a master innovator. Every year you produce a rat out of a hat. Tell me, this study which Piramide was trying to explain, has it changed your current practice of doing diversions?
Yes, I think that you have many implications, clinical implications, because I think that it clarifies exactly what is the technique, especially in the neobladder, because there are many possibility to do the configuration of the bladder, of the neobladder, and so the doctors, the urologists, that they can have the possibility to see this video, well, they can select the best neobladder for their patients, but not only this one, but as well the best neobladder that in their experience they can be configured. Moreover, I think that based on the data, they can change their technique, because we don't need to focus always we don't need to maintain always the same technique, but to have a confront with the others, and so they have the possibility to see all technique, and so to change as well their idea about what they have done in their experience.
Federico, when you picked up, I think this was your idea to begin with, isn't it? You were the principal person, or who thought of this question?
Basically, it was everything started with a discussion between me and Paolo, because I had the idea of the systematic review, and he suggested to create an atlas, a surgical atlas.
So now you are such a high volume center.
Yep.
What was the pain you wanted to address through this study?
I
Where were you dissatisfied, and that's why you thought of exploring all techniques to find out? Because this is in itself a big achievement, because surgeons are in comfort zone, they don't change easily.
Yeah, that's the point. You reach the point because I believe that once you saw in a systematic way different techniques, you can learn some tips to improve your own technique. Maybe you can see and compare your technique with another one, and maybe change your current practice because you can recognize, for example, that the how to avoid, for example, the transposition of the ureter. For example, if you're doing a Studer technique, for example. Otherwise, you can learn about the posterior reconstruction before doing the neobladder, which is, I think, very important. In fact, we find that many techniques actually reproduce this important step. And so I strongly believe in the educational significance, the educational impact of this type of paper for both young surgeon and expert surgeon.
You guys are known world over for your AI applications. In this paper, did you use any of the AI tools?
Basically, no. There
No.
were.
If I asked you, with the present development of generative AI or AGI, you think part of this process could be condensed by using AI tools?
Of course, I think that AI is something that is entering every day more.
Yeah,
in our
particularly literature search, analyzing studies,
yeah,
rather
yeah,
than
of course,
reading all the
analyzing the
studies.
results.
You think it has an application?
Yeah, of course. I think in providing an overview of the results of literature search, helping in literature screening, and of course it can provide a sort of draft for the discussion. For example, you can interact with the AI and you can may discover some topic that is important to reach out during the discussion, for example. So I believe it's an important tool. We have to be prepared, we have to know how to use it properly. So I agree with you that it's an important tool.
Professor Porpiglia, what is the future continuation of this work in your mind?
Your mind, so I think that based of what I learned in the last years, I think that we can change. I changed my technique, for example, in the last few months, and because the new bladder that I made up to some months ago, in my opinion, they had some critical point. I tried to improve it, and so now I change a little bit because the Ipson shape, in my opinion, they have not a dome, and so I try to modify it. Moreover, I modify as well the anastomosis between the ureter and then the bladder, the new bladder, because we focus a lot our attention about the capability of the capacity of the bladder, about the side effect that we have during the night, but often we don't consider the possibility that patients they have often fever because they have the reflux between the neobladder and the ureter. So I try to modify the technique in the last months because I want to prevent the reflux and obviously the infection and the fever to improve the quality of life of our patients. So the technique and the neobladder that they show, I think that we need to improve, and I try to do it, especially in three aspects. One of the most important is the quality of the anastomosis that should be addressed not only for preventing for preventing the stenosis, but as well for preventing the reflux between the neobladder and the urethra.
Thank you very much.